we have a patient that is a 28-year-old woman that's been brought in by ambulance 3 hours ago.
Okay.
She's been waiting a while, and it sounds like she's having some shortness of breath. So
Okay.
let's go see what's going on.
Let's investigate.
What brought you here today?
We were leaving Hooters and she was driving crazy and made us crash.
That's not true! He was staring at other women's boobs! And then we got into a car accident!
Okay.
I can't breathe!
So
And
you're
my
having some shortness of breath?
Yes, and my chest really hurts!
Oh, I'm so sorry.
On a scale of 1 to 10, what would you rate that pain?
It's an 8!
An 8. Okay, sounds serious.
It's really serious.
Okay.
When I bought these were the same size, so someone needs to fix this.
Yeah, about 3 months ago, these were different.
Looks like she's having some shortness of breath.
Okay, do you think I should put the oxygen sensor on and see her O2 stat?
Absolutely. And
Okay.
then I'll start her on 2 liters of oxygen for comfort.
Perfect. Ma'am, may I please see your finger? I'm just going to put this on your finger so we can check your oxygen saturation.
What's that mean?
It's how much oxygen is in your blood, so we want to make sure that you have enough. If not, we can provide you with some.
Oh.
Okay, looks like she's at 92%.
Let's go ahead and start that.
Okay.
We're going to go ahead and start our assessment now. We're going to listen to lung sounds, and I'm just going to have her take that shirt off, because you should be proud of those, right?
Very so.
I'm going to go ahead and start the assessment by listening first to lung sounds. If you want to go ahead and start the physical history.
Okay, wonderful. So, ma'am, while she's doing that, I'm just going to kind of be asking you some questions about your health history.
Okay.
Now, have you had any injuries or surgeries, any broken bones or anything like that in this area?
I did suffer a few broken bones in my clavicle on a ski accident trip about 3 years ago.
3 years ago. Okay,
I
got that
see.
in there.
I see a scar right here, yeah.
Yeah.
Oh, yes, I do note that.
Yeah,
Okay, I'll put that on here. And did you have any surgeries to repair that?
No surgeries.
Okay.
I just got my surgeries on my boobs recently.
Okay, yes, we can see that. Okay.
Can you take a deep breath? Does that hurt?
Yeah.
A little bit?
And while she's listening to the lung sounds, I'm just doing a quick visual assessment, noticing that the patient is visibly breathing very hard. She is using some of her accessory muscles while breathing, indicating that she is in fact short of breath, but the oxygen does seem to be helping. The mucous membranes appear to be pink and moist. Okay,
Go ahead
so
and sit forward for me.
now that she's sitting up, I can see the chest wall and configuration is a clean 2-to-1 ratio. So 1-to-2 ratio. So I'm writing that down on there.
Go ahead and take a deep breath for me. Yeah, something we might consider is cardiac contusion, mentioning that to the doctor.
Okay.
Because when
What's a
she was
contusion?
in a pardon me?
What's a cardiac contusion?
So cardiac contusion is something that when you're in a car accident, because you had, you were the driver or the passenger?
I was the driver.
You were driving.
I was
Good
the
for-
driver.
good for
It's kind
you.
of hard, but
Yeah, that's good. I can see how that would be difficult. When you're the driver and you have the airbag go off.
Yeah.
Yeah.
Yeah, good thing my
Yeah.
boyfriend paid for that.
Oh, good. He
Yeah,
pays
he
for a
didn't want
lot.
the
It looks
airbags.
like.
He just wanted these airbags.
Well, when the airbag goes off, especially if you have the seatbelt going across you too, and that compression that you have that's real fast like that,
Yeah.
it'll make your heart do this in your chest wall, and it kind of slaps
I
into the
understand now.
chest wall, yeah,
Yeah.
and it can bruise it. So when we go ahead and do a breast exam, the first thing we're going to do is have the patient get comfortable
And then
sit
squeeze the
back.
nipples?
We're not going to squeeze the nipples.
Oh,
I always squeeze my nipples.
Yeah, well, we'll let you squeeze your own nipples. But right now, we're going to go ahead and do a breast exam because I do see some bruising across where the seatbelt. Wait, let's not poke. What we want to do when you do a breast exam, you use the flat parts of your fingers.
Okay, flat fingers.
And we're going to go ahead and have you raise this arm up for me. Put it just like that. And we're going to start over here,
This
close
one
to
too?
the shoulder. Yeah, go ahead
Okay.
and raise that arm up. Perfect.
Thank you.
And we're just going to palpate all the way around.
Okay.
And we're going to palpate
Is
in a
this good?
circular motion. Okay. Yeah. I can feel a palpable border inside where it feels like the prosthesis is still intact inside this breast. I'm going to go ahead and compare it to this one.
Okay, great. It feels smaller.
It does, and it looks smaller. And yeah, I don't feel, I'm sorry. That's very painful for you.
Expensive.
I'm sorry. Painful in more ways than one. I don't feel the border as palpable on this side. So we'll go ahead and talk to the doctor about that as well. You can put your arms down.
Thank you.
You're the student nurse. I know that we just went ahead and did a chest assessment. What do you think we missed?
Well, I noticed in your assessment that you said the patient had some wheezing. So I remember from school, should we do some percussion on the lungs
You
to
can
listen
definitely,
for sounds?
absolutely. Go ahead and do some
Okay.
percussion, and I want you to, when you're doing that palpation first, you're going to put your hands on her.
Okay, so we're palpating first.
Right.
We did on the breast, but on the chest area.
Right.
Any tenderness?
Just
a little bit of
I think
tenderness.
it's from the bones.
Okay.
Okay.
So
I don't
if you if you feel any vibrations, do you feel that?
No vibrations.
Okay.
Everything
And
feels good.
okay, and now I want you to go ahead and do some percussion. Do you remember how to do that?
Yeah, so 2 fingers flat, and then
Mhm.
using the other 2 fingers and thumping lightly. Sorry, ma'am.
Especially since, yeah, she's having a little bit of pain.
Sounds normal.
That may be
Can you sit
difficult.
up for me? Thank you. Sorry, ma'am. Okay, so I'm just going to percuss again up here.
Mm-hmm. Good. And then, yeah, make sure you get the lower areas. So it would be the bronchial, vesicular, and vesicular regions.
Okay.
Good.
Very good.
All
Thank you,
right.
ma'am.
Go ahead and sit back. So it's really important when you're interviewing a client, especially anything about the breasts, that you establish how you feel about breasts as well. Because if you're very uncomfortable, the patient will feel that. So we're
Okay.
going to talk to her about when her last period was. We're going to talk to her about the breast augmentation and how important it is to do self-breast exams.
Okay.
Hi, we just wanted to do a quick education with you.
Okay.
Are you okay doing this education in front of your boyfriend?
My boyfriend? Yeah. He's been there for
Okay.
everything throughout the
Oh,
week.
good.
This
It's
is like our
nice.
4th time around.
Oh,
Yeah.
it's good to have that support. So, can you tell me when your last period was?
You remember that time? That was bad. It was about a week and a half ago. I mean, how could you forget?
Okay, so a week and a half ago. It's important to note that because there's certain times of the month where your breasts are going to be
Right.
more swollen and they hurt more. So that can definitely affect your breast tissue. You also, do you do self-breast exams?
Well, we kind of do it together. But I do, he kind of makes me, but I do
Okay.
feel them every once in a while.
Good,
They're
good.
just-
Once a month, you should be
Once-
doing them just after you've had your period.
Like 30 times a
Like
week.
a week.
Yeah.
Oh, 30 times, that's good.
Yeah.
Just once a month is the best time to do it in order for you to get to know your own breast tissue.
Okay.
Okay?
Okay.
Especially with augmentation because it does change things. You want to be able to move that that basically gel packet around, or was it saline?
It's saline.
It was saline. Oh,
Saline.
good. Because you may have a rupture on that side, it's safe for the body.
So I should go like how you guys are doing?
Yeah, you
Oh.
start off in a circular motion,
Mhm.
going all the way. Yeah, you don't have to squeeze your nipples like that. If you just do with your fingers flat,
Uh-huh.
like this, there. Oh.
Are you watching? Don't squeeze the nipples only.
Yeah, why don't we talk about that?
Okay.
Yeah. So if you're gonna squeeze your nipples, just be very gentle, okay? And only do it just enough to see if anything's coming out. If anything's coming out, that's something you would want to talk to your doctor about, okay?
Okay.
Okay, so hello, Dr. Funk. We have a 28-year-old woman who was brought in by ambulance to the emergency room about 3 hours ago. She was involved in a motor vehicle accident, and she has a breast augmentation. One of the breasts on the left side now is noticeably smaller.
I may need to take a look at that one.
She was also wearing a seatbelt. She's complaining of chest pain, which is 8 out of 10. She's also having some shortness of breath, and her boyfriend is present with her.
There's some bruising across the breast tissue, and the area that is affected is also quite a bit smaller. The borders are actually not as palpable on that left breast as the right. So it's possible that ruptured, and it is saline, not gel.
Good.
We also went ahead and did a quick lung and thorax assessment, and everything appeared to be normal.
Great.
What would you recommend at this point?
I would definitely recommend that we put an order in for the EKG just to make sure everything's going okay with the heart and rule out any conditions there. Because this sounds like the saline implant did rupture, it is safe for the body to absorb that saline, but we'll want to put a referral into Dr. Hooter to correct the appearance of the augmentation. And I think we've got the respirations under control, it sounded like with the oxygen and the O2 sats, so we'll put in a prescription for Vicodin to help manage the pain.
Okay. And what would be the best prescriptive strength?
I think we'll start with the 6 milligrams by mouth every 4 hours, or as needed, but no sooner than the 4 hours to help control the pain.
My milkshake brings all the boys to the yard. They're like, it's better than yours. Damn right, it's better than.
You want to eat some crackers with it.
Okay.
Okay?
Diet crackers.
I love my boobs.
Wonderful.
They look amazing, by the way. What doctor did you go to?
Dr. Hooter.
Oh, yeah? Because I
Yeah.
was thinking about, maybe.
You should. You should.
Yeah?
It benefits you. You love it.
Let's go ahead and just take that
Oh.
off.
I
Nice areolas.
Oh. Yeah, it gets more attention.
Let's just put that there. One thing that we would like to know is when you had your last period.